The first learning component for Miss May is she must be able to write a minimum of 5 signs and symptoms of peritonitis. There is a spot in the booklet that I have created for her that she will be able to write down when I finish my teaching. The second learning objective is Miss May must be able to state which signs and symptoms she must call 911 for. That also could be life-threatening. She is stating these because they are more critical than just the regular signs and symptoms. The third learning objective for Miss May is she must be able to explain the need for proper hand washing in reducing infections, and she must be able to relate peritonitis to her medication prednisone. The last learning objective, Miss May must be able to demonstrate the proper hand washing technique using warm water, soap, paper towel, the proper hand washing movement, and also it has to be 20 seconds long. After assessing Miss May, these 4 learning components will teach her self-care skills and help her to promote her health promotion. So during the teaching lesson, I will go over the first and second learning components related to peritonitis, since she does not have any knowledge of this medical diagnosis. After the 2 learning objectives are finished, I will quiz her, so that will be writing down a minimum of 5 signs and symptoms for the first learning component, and the second will be verbally stating which signs and symptoms need medical help. The third learning component we will go over, and then at the end of that we will have a little quiz. And then finally we will go over the last hand washing component, and she will have to return demo to me, and then we will go over a question period. So when we first start, I have created this booklet for her, and we will be going over it together so she can take it home. And in this, there's a section at the very back for questions. So anytime during this, she can write down any questions that she has, and I will answer them at the very end. And there's also a section for feedback for the nurse and the client, and she'll be able to take this home and have all the same information as what I have taught her. So we're going to go over the first learning component regarding peritonitis signs and symptoms. So the first thing I'm going to do is explain to you where peritonitis happens in the body. So the peritoneum is the cavity where it happens. It's a continuous transparent membrane which lines the abdominal cavity and covers the abdominal organs. So on page 2, there's a diagram here which shows you where the peritoneum is. And in here is the visceral, and then the peritoneal cavity is this whole thing, and the peritoneum is just the outside lining. So the parietal peritoneum lines the internal surface of the abdomen pelvic wall, which is this right here, this red mark around. The visceral peritoneum covers the majority of the abdominal viscera, and that's that whole thing in there. So this is where your infection is.
Okay.
Peritonitis is a bacterial or fungal infection of the peritoneum. So some signs and symptoms of peritonitis include stomach pain, fever, nausea and vomiting, loss of appetite, diarrhea, low urine output, thirst, inability to pass stool or gas, fatigue, bloating, or feeling full in stomach. And fatigue means tired.
Okay.
Do you have any questions?
No.
Okay.
Not yet.
Because here's a pen for you to write them at the very end.
Thank you.
So that is the first learning component. I'm going to go on to talk about which signs and symptoms you need to call 911 for. So these are very serious symptoms that you need to seek medical help for because they could be life-threatening. So these symptoms are fever, in case your fever gets very, very high.
Okay.
Nausea and vomiting, low urine output, being very thirsty,
Okay.
and being unable to pass stool or gas. So any of these, you must call your doctor or the hospital, or just go into the hospital because serious complications could happen.
Okay.
Now we're going to watch a video regarding peritonitis, just to reiterate the signs and symptoms and what peritonitis is. So this is a 3-minute video that I'm going to have you watch.
Hello, this is Dr. Carlo Ojed, emergency physician and founder of edxitvideo.com. To find videos like this related to the care of emergency care patients, please come to edxitvideo.com. This video is about peritonitis. Peritonitis is an inflammation or irritation of the peritoneum, the tissue that lines the abdominal wall and abdomen and covers the abdominal organs and keeps them inside. What are the causes of peritonitis? A collection of pus in the abdomen called an intra-abdominal abscess may cause peritonitis. In people with ascites, peritonitis can be caused by spontaneous bacterial seeding of this fluid. People with ascites or hepatitis and chronic diseases can have a weakened immune response, and these lead to bacteria leaking into the abdomen. Because there's a lot of fluids, it creates a perfect medium for these bacteria to grow. Also, peritonitis can result from penetration of the abdominal wall by infection on the abdominal wall muscles itself, or perforation of a diverticula, an appendicitis, or any kind of local infection within the abdomen. Peritonitis. Symptoms. The belly or the abdomen is very painful or tender. The pain may become worse when the belly is touched or when you move. Your belly may look or feel bloated. This is called abdominal distension. Other symptoms may include fever and chills, fluid in the abdomen, passing few or no stools or gas, excessive fatigue, passing less urine, nausea and vomiting. Signs and tests. The doctor will perform a physical exam. Palpation of the abdomen usually results in a tender exam and may feel firm or board-like. The patient may guard the area by tightening the stomach muscles when examined, curling up, or refusing to allow the area to be touched. Blood tests, x-rays, and CT scans may be ordered. If there is a lot of fluid in the belly area, the doctor may use a needle to remove some of it and send it for testing, analysis, and cultures. Treatment of peritonitis. The cause must be identified and treated promptly. Treatment typically involves surgery and antibiotics through an IV. Complications of peritonitis. Peritonitis can be life-threatening and may cause a number of different complications. Complications depend on the specific type of peritonitis. You must call your healthcare provider or go to the nearest emergency department if you have symptoms that sound like peritonitis. Increasing abdominal pain, abdominal girth, distension, fever and chills, vomiting, failure to tolerate fluids, or otherwise progression of the symptoms.
Okay, so even though that video was a little bit more in-depth
Hello,
than what I'm
this
teaching.
is Dr. Carlo Ojed, emergency physician, founder.
Sorry. So even though that video was a little more in-depth than what I'm teaching, it just still goes over all the signs and symptoms. Since you are on antibiotics and you understand that you need to take the whole thing, then the life-threatening signs and symptoms just mean that the antibiotics aren't working or something else is happening. So that's why I'm teaching you the life-threatening signs and symptoms too. So now that we've gone over the 2 learning objectives, I'm going to quiz you on both of them. So as we talked about before, you need to be able to write 5 signs and symptoms in this worksheet I have for you right here. Okay, so any 5 that you can remember.
Okay.
Okay.
Well, there was stomach pain and tired or being fatigued.
Yeah.
And bloating.
Yeah.
And bloating. And loss of appetite too. And I think being really thirsty too.
Yes. That's the last one.
It's a lot of information.
Yes, it is. So you have identified 5 signs and symptoms, so I know that you understand peritonitis. Since I have made this booklet for you, you will always have this the booklet of all the signs and symptoms that you know. So if you do go home and you can't remember off the top of your head, you always have this to go back on.
That'll be a good reference.
So the second learning objective is you must tell me verbally which signs and symptoms you need to go in to seek medical help. So these are the most crucial signs and symptoms. This could mean that there's a complication, or the antibiotics isn't working, or something like that.
So if I have a fever,
Yeah.
I'll have to go in,
Yeah.
and if I have nausea or vomiting,
Yeah.
if my urine output
Yeah.
is very low,
Mm-hmm.
I would have to go in,
Mm-hmm.
and if I'm very thirsty, I get really thirsty, and if I have trouble passing stool,
Yeah.
I think,
And something else.
and gas,
Yeah.
stool or
So
gas.
any of these
Then I'll
signs and
have to go
symptoms
in.
that you told me, you have
Okay.
to go to the ER or call your doctor. Okay.
And those are in my booklet too, right?
Yes.
Okay.
So do you have any questions or anything about it?
No,
Okay.
no, I think you've
Okay,
covered that part.
it's a lot of information, but
But I have my booklet.
okay, sounds good. So the third learning objective that we have created is regarding prednisone. So you did not have much knowledge about prednisone and the risks of taking it. So since you have peritonitis and you actually know what that is now, we will go over why prednisone is such a high-risk drug. So prednisone is a corticosteroid. It prevents the release of substance in the body that cause inflammation. It also suppresses the immune system. So this means that you are more likely to get sick and contract other bacteria or viruses. So since peritonitis is infection of the peritoneum, then you are at high risk for complications.
Okay.
So you're on prednisone because you have arthritis.
Mm-hmm.
So that's
My
why you're on it.
arthritis,
But
yes.
the most important thing to know is that the steroid medication can weaken your system, and so
Okay.
you're more likely to get sick.